Concept 8, Fluid and Electrolytes. Goals for today's presentation is 1. Define and describe this concept. 2. Discuss the risk factors for impaired fluid and electrolyte balance. 3. Recognize the causes of fluid and electrolyte imbalance. And 4. Provide appropriate nursing and collaborative interventions to promote fluid and electrolyte balance. Okay, so fluid and electrolyte balance definition is the process of regulating the extracellular fluid volume, body fluid osmolality, and plasma concentrations of electrolytes. Scope and categories. Optimal extracellular volume is in the middle, excess is to the right, and deficit is to the left. And that's in the arrow A. Arrow B is optimal osmolality. They're talking about electrolytes and osmolality. Sodium is 135 to 145 milliequivalents is normal. Too concentrated is sodium of greater than 145. Osmolality greater than 300. Too little or too dilute of fluids is a sodium of less than 135 and an osmolality of less than 280. This is in arrow B. Arrow C is optimal potassium concentration is 3.5 to 5, and hyperkalemia, which is too much, is potassium greater than 5, or too little is hypokalemia, which is potassium less than 3.5. That's in arrow C. Populations at greatest risk are the very young and the very old. As you get older, your fluid capacity decreases, and when you're young, your fluid capacity is greater than your body mass. On page 63 in your concepts book, chapter 8, it is showing you in figure 8.2. The first picture shows equivalent fluids, normal output, normal intake. So the extracellular vascular fluid is normal, the osmolality is normal, and the plasma electrolytes are normal. Normal output is balanced by normal intake. In the next picture, extracellular value is normal, the osmolality is normal, and the plasma electrolytes are normal. But this is decreased output balanced by decreased intake. And the third picture, extracellular volume is normal, osmolality is normal, and plasma electrolytes are normal because increased output is balanced by increased intake. And now if you look in Concepts Chapter 8 again at page 66, the A picture is normal output but deficient intake or absorption. So you can see where the extracellular volume is a deficit, the osmolality is too high, and the plasma electrolytes are deficits, meaning too low. In the next picture, increased output is not balanced by increased intake. So you have an increase of intake, decrease of output, which means the extracellular volume has a deficit, and the osmolality is too high, and the plasma electrolytes have deficits as well. In the B picture, output is less than excessive or too rapid of an intake. So in this case, the extracellular volume is an excess, the osmolality is too low, and the plasma electrolytes are excess. And the next picture is decreased output, not balanced by decreased intake. So you have extracellular fluid excess, you have osmolality too low, and plasma electrolyte excess. Also, just a note, the ECV that you see in this chapter is actually extracellular fluid, which we call ECF. Water regulation is influenced by several things. One of them is habit of thirst, oral intake, and the most important reason for thirst is increased osmolality of body fluids or dry mucous membranes. Also angiotensin 2, angiotensin 3, and arterial baroreceptor stimulation during severe hypovolemia also trigger thirst. Um, Electrolytes also have an influence on water regulation. Um, let's see. As far as the role of fluid in the body, produces saliva, regulates body temperature, gets rid of toxins. It's important for bowel movements and basically uses water in all its cells, organs, and tissues to help regulate temperature and maintain other bodily functions. Because your body loses water through breathing, sweating, and digestion, it's important to rehydrate. As you know, water makes up about 60% of our bodies, and our blood is 90% water. Water is essential for kidney function and other bodily functions. It lubricates the joints. It forms saliva and mucus. It delivers oxygen throughout the body. It cushions the brain, spinal cord, and other tissues. Again, it's important for regulating body temperature, and the digestive system also is dependent on it. It's important for flushing out waste through urine and feces. Also, it maintains blood pressure, and the airways need it. If we don't have it, this can make your asthma and allergies worse. It makes minerals and nutrients accessible because they dissolve in water. It prevents kidney damage because it prevents kidney stones. And it carries nutrients to the cells for food. Electrolyte regulation includes aldosterone, which is released from the adrenal cortex, also the antidiuretic hormone. And remember that they can help with potassium depletion or potassium overload. Also, the antidiuretic hormone has to do with the sodium release or retention, which influences fluid as well. Electrolyte distribution. All the electrolytes except for sodium, which has a high concentration in the extracellular fluid that reflects osmolality. Electrolytes have low concentrations in the extracellular fluid compared to their concentration in their electrolyte pools. The potassium pool is inside cells, which contain almost 98% of total body potassium. Bone is an important calcium pool where the calcium hangs out. Magnesium pools include inside cells and bones. And physiologically inactive forms of calcium and magnesium bind to albumin or other anions that sit in electrolyte pools. Opposing factors influence distribution of electrolytes between the extracellular fluid and the electrolyte pools. For example, two hormones influence calcium distribution: the parathyroid hormone, otherwise known as PTH, from the parathyroid glands, and calcitonin from the thyroid. Calcitonin moves calcium into the bone. PTH shifts calcium from the bone into the extracellular fluid. Unusual amounts of factors that shift electrolytes can alter their distribution and cause plasma, electrolyte deficits, or excesses as well. As far as fluid and electrolyte imbalances, you could have impaired perfusion, impaired gas exchange, oxygenation, impaired cerebral function, and impaired neuromuscular function. A normal volume of extracellular fluid is necessary to provide tissue perfusion and give oxygen to the cells. Moderate or severe extracellular fluid deficit, or I should say extracellular volume deficit, reduces tissue perfusion by decreasing blood pressure. Very severe extracellular volume deficit leads to hypovolemic shock, a condition that severely impairs perfusion and oxygenation. Extracellular volume excess can also impair oxygenation Edema fluid or edematous fluid from extracellular volume excess pushes cells farther from the capillaries, creating a larger distance for oxygen to diffuse before it reaches the cells. Severe hyperkalemia causes cardiac arrest. Osmolality imbalances cause shriveling of the cells in cases like hypernatremia, or swelling, hyponatremia of the cells. Impaired cerebral function occurs with either condition, under or over extracellular volume. The usual cerebral impairment is decreased level of consciousness. Also, seizures may occur if the osmolality changes too fast. Impaired neuromuscular function um, is a response to plasma concentration. If there's imbalances of potassium, calcium, magnesium, they can impair neuromuscular function. If you have a calcium, magnesium, or a magnesium deficit, it causes muscle twitching and cramping. If you have a potassium deficit, it's gonna cause muscle, flaccid, flaccid muscles and muscle weakness. I think I said deficit of potassium. I meant too much potassium can cause the flaccid muscle weakness. Sorry about that. On assessment, symptoms of fluid electrolyte imbalances are nonspecific. Consider symptoms in the context of the risk factors for vomiting, diarrhea, organ failure, unexplained nausea, fatigue, shortness of breath, muscle cramping, edema, and sudden changes in weight. These imbalances will be found in your book under the electrolytes imbalances. And if you look on page 70, you'll see Table 8.2, clinical manifestations of electrolyte imbalances. That should help you, and as well as clinical manifestations of a disrupted fluid balance is also on that same page. Clinical findings as far as fluid imbalance are dependent on the type of imbalance and the severity. And you want to consider the functions of the following fluid compartments to think about symptoms if there is too much or too little. Again, this is on page 70, table 8.1 for too little volume, too much volume, too dilute in terms of osmolality, or too concentrated. Again, there's a nice table for you, table 8.1 on page 70. Okay, so we have direct measurements of serum levels, sorry, and that would be on page 70. So, okay, so let's go over normal ranges again. For potassium, it is 3.5 to 5.0. I think I already stated the sodium is 135 to 145. And the potassium is 3.5 to 5. The magnesium is 1.3 to 2.1. EKGs can show changes from electrolytes, especially with potassium levels, and I think it's an inverted, U wave at the end of the QRS T that would indicate an imbalance as well. Primary prevention to minimize risk factors is patient teaching about fluids and electrolytes, and dietary measures regarding these changes that they may need to make. Fluid management is adequate intake, especially with vomiting or diarrhea, and limiting intake when you're prone to edema, and probably limiting your salt as well. Secondary prevention is there's really no screening for fluid and electrolyte imbalance, but they would sometimes draw your blood and check as part of a disease or an illness. Collaborative measures include oral fluids, IV fluids for water replacement, electrolyte supplements and replacement, orders for potassium, sodium chloride, magnesium, and calcium would come from the provider. Pharmacotherapy includes diuretics, insulin, and vasopressin. Additional interventions would be daily weights, especially for someone with edema, or fluid gain or fluid loss, monitoring fluid I's and O's, safety measures, especially for those who are having a decrease in level of consciousness with electrolyte disturbances, or volume disturbance, in other words, imbalance of volume, too little volume, hypovolemia, which would lower your blood pressure. Comfort measures for nausea, vomiting, and anything that would be an electrolyte imbalance problem. Also oral hygiene, frequent oral hygiene for people with dehydration, and patient teaching on all of the above. These are some of the interrelated concepts to the fluid and electrolyte management: nutrition, mobility, hormonal regulation, cognition, perfusion, gas exchange, acid-base balance, and elimination. They're all interrelated. As you can see, the arrows are going back and forth. The exemplars of fluid and electrolyte imbalance include fluid imbalances of extracellular volume deficit, extracellular volume excess. I didn't mean volume, I meant vascular, sorry. Hypernatremia, which is increased osmolality, and hyponatremia, which is decreased osmolality, which happens with water intoxication, and dehydration, which is extracellular volume deficit plus hypernatremia. Electrolyte imbalances: hypokalemia, hyperkalemia, hypocalcemia, hypercalcemia, hypomagnesemia, and hypermagnesemia. Question: what is an example of a third space? You should be answering the interstitial compartment. What are examples? Include all the examples, it should say, of regulated routes of fluid and electrolyte output. What kind of things regulate fluid and electrolyte output? That would be, for sure, urine and sweat, skin and lungs, feces and vomit, not so much tears and nasal secretions. So you should have the first three. And what is the most common route of fluid and electrolyte intake? And your answer should be oral. That is the end.